why don't we go ahead and get started? We'll call the meeting to order, Board of Health at 7:31. Welcome, everyone. So why don't we go ahead and get started? We've got actually two sets of minutes that we need to approve, one from the September 14th meeting and one from the October 9th meeting. Hopefully everyone has had the opportunity to take a peek at them. Does anyone have any questions or comments about the September 14th meeting minutes? If not, can I get a motion to approve the minutes as written, as presented? Great, thank you. Can I get a second, please? Fantastic, Dr. Hodges, thank you. All those in favor, say aye, raise your hands. Any opposed? Any abstentions? Great, thank you. Looking at the October 19th meeting minutes, hopefully, again, folks have been able to take a peek at those. Any questions or comments or edits? If not, if I can get a motion to approve those minutes, the 19th, thank you. A second, please. Thank you. All right, all those in favor? Thank you. Opposed? Abstentions? Great. Motions have passed. I know I have the agenda here someplace. Sands, I think it's your report, correct?
It'll come to me, yep. Okay, and so, Andrea, I'm going to share my screen. Let's see. Get this one. No?
Can you guys
Sally?
hear me?
Yes. Sally, can you hear us?
Yeah, I'm sorry. My gamer son has a really weird setup here. And I'm green somehow too, so okay.
Okay, so I was going to start with just sharing some of the data. So today we saw some significant increases. So if you, and I don't know if I can make this bigger, is it Shift Plus? Let's do it. It's a little bit bigger. Is that readable by you guys?
Yeah, that's fine.
All right. So today we saw a fairly big jump, 170 cases. That's, of course, that's includes Friday, Saturday, Sunday data. But what's happening now is we're starting to see once again some increases in both university cases, but town cases as well. Just everything seems to be going up. As you're well aware, things are changing in Connecticut. So I'm just going to kind of scroll down. You can see, both universities have jumped up 452. Actually, Sacred Heart is right around that same. If you look at their total campus, is 488 for their total campus. The 224 there is really just those cases that are on campus that represent as close as we can Fairfield cases. So you'll see here, this first one kind of shows, this is by cases by date reported. You can start to see that our second wave is getting close to, if not exceeding, the first wave. And that's, and you'll see that our overall cases ramping up with lots of new cases. And then here's by specimen collection date, and you can really see the comparison to what's happening now versus what happened in April. And so we are clearly well into the second wave, and the average age is right now is 33. And I'll go down to this one where we're seeing overall about 31% of the cases that are seen in Fairfield is from university, 20 from elderly facilities, and 48% from general population. If you were to separate the first wave and just look at from September 1st, that would go to about 64% is university, and the rest is general population with like 1 or 2% nursing homes. Yeah.
And I'm sorry, before you go on, I'm sorry, I forgot to mention, could everyone just mute unless you're speaking? Thank you.
And so I wanted to skip over to just to show what's kind of going on. This is the map in Connecticut in terms of cases per 100,000, new cases per 100,000 over the past 14 days. The red represents greater than 15 or more cases. This is that community alert system that I think they just started rolling it out last meeting, or they were talking about it last meeting. And so this is now where the state stands with a lot of the cases being in this new red alert category above the 15 cases per 100,000. Fairfield did go into it for 1 week and then drop back out. Given the cases that we've seen recently at Fairfield U and Sacred Heart, as well as in the town, we think we'll probably go back into the red next week, as many more towns will in the state. And so you can look at Fairfield County, you look at what's happening in the New London area, Hartford and Waterbury and Danbury areas, that sort of red block up in this area here, and so it's things are happening and changing in the state. So I thought I would share that, and then a little bit of what's going on with Fairfield U right now. Make sure I got this right. So over the weekend, so last week they saw a lot of new cases. There was, I want to get the numbers right. Wednesday, Thursday, Friday, they saw 29, 44, and 26 cases. But then over the weekend, they saw, 6 cases on Saturday, 4 cases. They implemented some mitigation strategies. We're hoping that those are effective. It's a good sign that they didn't see lots of symptomatic students pouring into the health center over the weekend. So they don't do any bulk, mass testing on the weekends, but the numbers were relatively low so that we're not seeing lots of students, which is a good sign, but we'll see. They have Tuesday and Thursday. They're going to be doing about 1,100 tests between those 2 days. But, you see over here 4 cases. They're up to, with about 137 total active cases on campus right now, and a total of 488 cases altogether. And this is interesting. They give you this share bar, and then it's in the way of the tabs. I don't know how to get around that.
Sans, these are all asymptomatic screening.
Screening, let me go back to that. Yeah, so the random surveillance is, if you go down to this cumulative results one, or up to this one here, the random surveillance is the screening types of tests that they do, where it's just they take 300 or 400 students, they randomly select them, they run them through, and they get those results. And you can see, out of the 2,076 random tests, they've only had 21 positive. So their positivity rate on random is pretty good. Then they do selected populations. So that's, for example, when those first numbers that I said to you that came last week, where their initial indications were it was starting with beach area students, and so they arranged to test 350 some odd students on Thursday, and just in the beach area. So they basically said every beach student is required to come and get tested. So that's what they mean by their selected populations. And then they also do things like there was a party with one particular team, the boys and the men's and women's team, and they got together for a party, and guess what? There was a bunch of cases on that team. So they had everybody on the team tested. So that's their selected. The diagnostic is those who come into the health center and get tested, and then the external is those who go to other testing sites and just report their results the university. So looking at that, and I'm trying to see if I have. Let's go with sacred. I had it pulled up before, but pull up Sacred Heart's dashboard. Last week they went into the red alert level status. They saw a number of cases. I'm just scrolling down. So, for example, their cases were predominantly on campus this time. Last time they had a situation, it was off campus. So right now they've got 130 active cases on campus, 57 off campus, 191 total active. If you add up these two, that gives you a total, which is comparable to what,
Sorry, Sands, I apologize. Yeah. Did you switch screens? Because I still see Fairfield U, and it may just be me. I don't know if anyone else sees.
Oh, let me see. How about that?
There you go. Okay, thank you.
I pushed some button I didn't even know I did. Okay, so so over here, 130 cases, 57 down the side. These are the active cases currently on campus. So this 130 is nearly doubled in the last report from last Friday. And so they're seeing a surge. They've gone totally online with all classes. They've locked down 2 dorms that were particularly heavily affected. They've essentially started de-densifying their population, their campus, sending a lot of students home, offering testing. They've had to expand their quarantine facilities to be able to free up rooms in their isolation facility. So they were really struggling. Their numbers over the weekend, I don't have it right in front of me there, but I did get a report from them. Not as dramatic, not as low as Fairfield U, but their numbers weren't as high, and so we'll see. They did offer a lot of testing though over the weekend. They're using the Binex Now rapid antigen test cards, as well as Saliva Direct PCR on a number of the students who are essentially a lot of students trying to leave campus. And so they are reducing their population there, basically after Thanksgiving, there's going to be almost no activity on campus. There was no classes planned. They were but going to go full remote, other than those students who have to be on campus for clinical activity and the like. So that's kind of what's going on with the universities. Here's the latest on the school numbers. Make that a little bigger. So last week we saw our numbers kind of jump up, and you can see, as we start here in early September, very low numbers, gradually going up to where the last 2 weeks we saw, 50 to 80% increases. And then again, we're seeing, increases similar to that. Both in the dark blue is Connecticut going up to 19.9, Fairfield County going to 25.2, which is above the number where, if you were looking at learning models, that's above the number where the state guidelines suggest more remote learning. So we're still below at the state level. We had a 14.9, which kept us in the orange category. That was basically after the initial Fairfield U outbreak numbers kind of dropped off. And so, we did still went up from 14.5 to 14.9. So we still did see an increase, even though those numbers had dropped off, and that's largely due to what's going on in Connecticut. If you think about that map and what's happening in the county, the numbers are going up. And so that's the leading indicator there is the 100 cases per 100,000. If you look at the secondary indicators, percent positivity on the dark blue and the little less dark blue, the trends continue to go up. At the local level, we've seen some percent positivity go down. That's, a portion of that is related to just the sheer number of tests being done by the universities. So they ramp up their testing numbers, and so you're going to see the ratios change. But largely at the county and the state level, you're seeing those numbers go up. For percent positivity, for hospitalizations per 100,000, you're seeing the numbers go up in Fairfield County and at the state. And for hospital, COVID-like illness and hospital ED visits, you're seeing it go up as well. And so that's where those are somewhat trending. You can see that, if you look at this scatter plot here, you can see the clusters of cases that we're seeing are largely in this, 15 to 18 range, with cases going down to as low as 5 years old, but a handful down at the lower grades. And so, we're seeing, most every single school impacted in some way, whether it be by cases in the school or quarantines in the school related to household exposure. And so that is the data aspect of it. Just to do a couple quick ones on what's going on in Connecticut in terms of let's look at daily deaths. These are some of the models, the IHME models predicting what will happen. So this line here is kind of what their current projection for Connecticut is for deaths, leveling off a little bit, but going up until about January, early into January there. That says December 30th. Yeah, okay, yeah. So peaking around the end of the year for deaths, for daily infections, depending on which model, so if the mandates are easing, which it's not happening in Connecticut, so we don't think that'll necessarily happen, but IHME has us kind of peaking again for increase in daily infections and testing in early December. So those are just some of the projections there. Hospital resource use, again, the current projection, I believe, is up here. Projected is up here. So they are projecting possibility of exceeding hospital resources there, and that's a mask use one. So let me just see if there's one other I wanted to show you. And this is just, I want to show, this is COVID Act Now, shows the picture of what's going on in the country, where the red being active or imminent outbreak. You can see, excuse me, Connecticut is up there in the red, as well as with most of the country. And then just trying to get back to there, this one, I think. And here's what this COVID Act Now lists for Connecticut, that we're in the active or imminent outbreak, 27.7 daily new cases per 100,000. So that's what their sort of prediction right now. That's going to be a little bit off from what the state releases this week, because this is based upon date of reported, not date of sample collection. So that changes it a little bit, and some estimates of our positivity rate, ICU headroom, and infection rate. So that's the sort of data I wanted to show you. Carolyn had asked earlier to talk a little bit about flu, and I looked at the CDC and the state just to see what's happening. The state hasn't even issued their first flu report of the year because there's been so little activity. They're still showing last year's data. And on some of the charts on the CDC as well, they haven't even started reporting for this flu year. So the national map has Connecticut at very low activity, not the lowest, but just one mark above the lowest in the low category of three three sort of shades in the lowest category. So there's very little activity just coming across my desk. I am seeing very few flu reports coming through right now. And Henry, I imagine you're seeing the same down in Stanford. Very little. Yeah. So it's again, and this is, we'll see what happens further into the season. What was experienced in the Southern Hemisphere was very little flu activity because everybody's wearing masks and everybody's staying apart from each other. So it's kind of taking care of a lot of the flu activity. Hopefully it'll stay that way. Now I will get back to stop sharing. There we go. And then just kind of talk about some of the other issues. One of the things that came up, Jill and myself and others in the staff we have weekly meetings with CDC, DPH twice a week, State Department of Education once a week, another one regarding our grants with the State Department of Public Health, another one regarding mass vaccination planning. We do town planning meetings. We participate in a weekly governor's municipal call. There's a town alerts for that, new town alert, community alert system, weekly call. We participate in that as well. There were two meetings with the universities, with the state, the universities and the town, one with Sacred Heart, one with DPH, both towards the end of the last increases they saw. And then again now this week and the end of last week to talk about what's going on their campuses. Both campuses have instituted similar types of significant restrictions. I talked about Sacred Heart, Fairfield U have restricted all the beach area students, similar to what they did before, a sort of stay-at-home directive where they're not supposed to go to anybody else's house. They're supposed to stay in their house and on their yard. They don't come to campus. They're not allowed to attend classes. They go remote. They are to arrange for food delivery shopping. They are restricting on-campus students. They've canceled the buses that bring the on-campus students to town and to grocery stores. They've restricted them to basically being on campus, and the only time they're supposed to be out of their dorms is going to class and back. They've closed the fitness center, the sports and rec areas. They've canceled all non-class events. And so they're really trying to lock it down and get a handle on this before it gets worse. And so they've taken decisive steps. They did everything the state is recommending of them. So one of the things that came up, which I thought would be of interest, is the new CDC info that came out today. Was they're talking about shortening the quarantine period. So the CDC may come out with something that, they weren't being very definitive on when, but there is consideration based on some recent studies to do a risk-based shortening of the quarantine period to essentially they're saying, that about 75% of all the cases show up within the first 10 days. And so that they felt like they could do a 10-day quarantine with a test at something like 7 days. And if you had a negative test and were symptom-free by 10 days, that you could come out of quarantine, with the understanding that we will miss some, because even the 14-day quarantine, there's a chance that you may miss some. So they haven't come out with it yet, but they had a discussion about it and shared some research about that. So that was an interesting point that they brought up. Also, just some new news that was shared today is about the vaccine efficiency. The Pfizer vaccine initial estimates came out as being 90% effective, which is good news, and that the spiky protein that they targeted seems to be the right one to have targeted, which is a good sign for the other vaccines, because that's where the leading vaccines have all targeted that protein. So it's a good sign, and the 90% is usually correlated with people willing to take the vaccine. if they know it's a very effective vaccine. So it's all good signs in that regard. And so now we just have to wait for some final either EUAs, emergency use authorizations, or some final approvals to enable delivery of it. We've already begun working on mass vaccination strategies. Have worked with the departments that would be in the phase 1A to start vaccinating critical workforce. So we are ready to go. We've got facilities secured to hold it, and we will be ready to go when we get vaccine. We did. Jill and I presented at the Board of Ed meeting on the 27th and answered questions for a fair amount of time, and got through most of them. A few social media. I heard I was on the ropes at one point from one social media post. Apparently, I didn't see it, but somebody told me that I was on the ropes for a while. But anyway, I thought it was a good meeting. I thought, everyone was respectful, and we were able to convey a lot of information and hopefully answered most all the questions that everybody had. And I did follow up with one member on some questions that she had asked that I didn't have the answer to. And then I'll wrap it up with we did submit 3 different grants that will assist us. Our per capita grant got submitted and approved, and funding was already received. Our ELC grant was submitted. We have a few comments, received some comments back on a few edits we have to make to that, but that should move forward. And then we also have had an opportunity to apply for a community development block grant where we might get 2 part-time positions to assist the department with COVID contact tracing and community outreach to underserved populations. And so with all 3 of those positions, we should be able to hire, several part-time staff. The per capita, we've already brought on 3 additional people. The CDBG, we've put in, upgrading 1 staff from part-time to full-time, and then 5 other positions, part-time positions there that should be a significant help to the department because, as Jill will share, the overwhelming amount of our time and effort is going to contact tracing at this point. It's really, as you can tell, we got, downloaded 100 some odd cases today, from the system, and you have to sort through them, and some go to the universities, and then we have a group left that falls to us. But that it's just a lot of effort. So I will wrap up my report there and turn it back to you, Henry.
Great, thank you. Sans, just one question: the block grant, is it a state funds?
It's actually a federal grant that goes to our community economic and community development department, Mark Barnhart, and essentially they got some CARES Act funding from the federal government. So they have a normal CDGB grant that they get every year, and they have different projects that they do. They got CARES funding for COVID related activities. And they put out a notice, and they didn't get much of a response. And so they, basically approached me and said, "Hey, we've got this money, and we want to use it." And and I said, "Well, this is what we need." And he said, "We can make it work." And so I submitted an application, so we may get, some close to $50,000 in funding to fund 2 part-time contact tracers there. That'll be predominantly contact tracers, but they'll also do community outreach, really looking to target, underserved populations, people with with barriers to getting information and care and response from the town.
Great, thank you. Does anyone else? Oh, I was just about to say, Christine.
Sam, I heard you say Sacred Heart is not coming back after Thanksgiving. Is Fairfield U bringing students back after Thanksgiving?
So they are bringing some students back. So they're sending the majority of home. There are no in-person classes after Thanksgiving, but they are. We talked to them about it. It was initially I had understood that the campus was largely going to be brought down to just like every campus has 100, 200 students that kind of weather it during the Christmas break, whether it be for sports or for international travel and things like that. And so Fairfield U is having a bit more than that. They said it's going to be less than 1,000 students, but not much less. And so we've had some discussions about that where the state and the town has expressed that, that's a lot of students to have around, and that they need to make sure that they address the concerns related to that. And so all those students, so for example, they said none of the students that are coming back after Thanksgiving are going to be from hotspot states. So that's states on the travel advisory. So none of the students will be from there. They also said that they're going to test, as they did all the students when they came to campus, they're going to test all the students prior to, so they'll essentially be tested and have to wait for the results, have to quarantine and wait for the results before they're allowed to, move about the community. And so the state talked about, requiring some additional testing, and they are going to be continuing with their, several days a week testing that they do of their students now with that population. And so they'll continue to be tested, but, both the state and the town, expressed concern about that number.
Okay, thank you.
Sure.
Can I ask one more question, Henry?
Mm-hmm.
Just about college students, but incoming, people coming back to town. Have you heard reports now that cases are increasing, just the ease on getting testing? Are there any plans to increase testing in the town to kind of just accommodate these students that potentially I would foresee there being some risk with bringing them all back from all across the country?
We've talked about it, and we've reached out to, the department has reached out to Bridgeport Hospital and to Optimus to inquire. So we're looking into that. We haven't set anything yet, and part of that is, one of the reasons is that when we talk to our contact tracers about, availability of testing, when they talk to all these people, that the general feeling from the contact tracers is that there is sufficient testing in town and in the area, both free and, you may have to wait a few hours to get it, but typically you can go and get a test the same day in several locations. And if you know how to play the game, so some of these people who do get tested, some people get tested more frequently, and that they know how to look around and see whose wait times are better. So, for example, last week, the long lots in Westport was 5 minutes in and out.
Yep.
This week, it's a 2-hour wait. And so, it's kind of like if you know how to look at call them up and see what's going on.
Sam, sorry to interrupt, but the St. Vincent's long lots one is, like you said, about a 2-hour wait. The Bridgeport one was a 5-hour wait the other day, and they stopped seeing people after a certain time because, even though it's open till 4, they're like turning people away at 3 because they just can't keep up with the numbers. And then the other quick places like AFC and Docs used to just do walk-in testing. Now most of them are starting to switch over to require a virtual visit prior to giving you a test. So it's not going to be as easy. And so I just wanted to throw that out there.
Yep.
Yeah, I had to get tested 2 weeks ago, and long lots, I waited about an hour and a half. I was there first thing. The day before I went to St. Vincent's, and the line was like a mile, miles long. For AFC, I made an appointment in Stratford, drove there, and then they were basically like, sorry, we can't see you today.
Okay.
So I want to piggyback off of that. Can you hear me?
That just spiked. So I'm just,
Can you hear me? No?
Hold on, Sally.
Oh, sorry.
I'm sorry.
Just concerned about with more kids coming back and possibly need to be tested.
Yeah.
Just, any recommendations or communications about where to go or suggestions to make it easier would be, I think, helpful.
Well, and we were gonna, what we did over the last few weeks is promote some of the testing sites nearby. Some of the ones that we've been told by the I think it was Optimus and Southwest were doing them, and they were relatively lightly attended according to them. That they were hoping to asking us to sort of make sure that people show up. And so we shared some of those on social media. But again, we're willing to look at it. We've talked to them. Some of them have changed their model from going from doing outside, setting up their pop-up tents, to now wanting inside facilities. So that was a little bit of a change. And so we're still working with them. We had communication with Optimus, I think today, and then I talked with Bridgeport last week about trying to get someplace in town, get on their schedule to have a place in town.
Thank you. And thank you for all the work that you've been doing with the contact tracing. You guys have been invaluable, and I really appreciate all the time that your staff has put in.
Thank you.
Thanks. Sally, did you have something?
Yeah. Can you hear me okay?
Yes.
Is there an echo? It must be the way the setting he has, so I apologize. I'm going to piggyback on what Christine said, that, I've been getting tested at the CHCs, in Stamford and sometimes Norwalk through work. And about a month ago, it was no line whatsoever. And CHC Fifth Street actually had a line around the block and had to have a police officer there. So I really do think that if we're able to, I think people didn't realize or didn't have the imminence before with the Bigelow partnership when that was one day on the weekend. So if we could maybe do some more of those, because so many people, they can't wait for 5 hours. If they have to work full time that day, for example, or have kid responsibilities, it's just not practical. So certainly if there's an easier way to do that, I would agree. With that, I got tested at Schofield Manor in Stamford today because they offered it to me, but they had a lab set up, like an out-of-house lab, basically, that came to that location. So, I'm not sure the options there, but I do think that would be helpful. I do have a variety of other questions, but I don't know if you want me to do that now or Summer about the charts.
Are they related to Sam's report?
They are, yeah.
Oh.
So, is that okay?
Mm-hmm.
Okay. One question when I go on the Department of Health website, and I did see your graphs, but do you have a specific chart that's just the overlay of cases versus hospitalizations versus deaths, like over since March? I feel like there's a lot of the cumulative and then a lot of things split into the, university versus community population. And I feel like there's still a major emphasis on the cases. So that's one question, just that real comparison.
So we do not have that right now. I've seen that chart. There's a gentleman that goes by Fairfield Data Engineer, and he produced a chart like that. So I've had some email communications with him, and so I've seen his chart, that particular overlay. I have a couple questions for him about it in terms of, how he presents the data. But yeah, but that exists out there. It's a privately produced one, but we don't have one. We haven't done that yet. We can probably do something like that.
I think that would be good, because my personal opinion, and certainly what I've seen buzz from that particular person and a lot of other people, social media and otherwise in my social groups, is, there's such an emphasis on the cases piece that I think it's hard to gauge right now the severity of that. Of course, we don't want cases, but it's just cases, So I think when you see the comparison, anything that I've looked at shows nowhere near the, mortality rates and hospitalizations that we saw back in April, spike-wise. I mean, I saw some of the trend lines on yours, but anyway, that was one question. Another one is, I know I brought it up at the last meeting, but what I would really like to see, and certainly a number of people in some of the parent groups I'm in, were so hyper-focused on coronavirus, which I know we have to be, but I would love to see some health data on, I wrote down a couple examples of like kids and adults seeking professional help, like clinical therapy or psych admissions. Somebody told me that that all of the St. Vincent and a lot of the mental health floors are actually completely booked right now. They're completely full. And certainly in, my home health, I've had a lot more major spikes with alcoholism and needing to help out with substance abuse type things that I've not really seen as much of in my career. Another thing, identification of school-age populations with new diagnoses, for example, like anxiety, ADHD, OCD, depression, suicidal ideation. There were some numbers that were coming around about significant increases in Connecticut in suicides. I don't know if those are correct, but there was one that said 4 suicides in October alone. So anyway, there's just some of those. Another big one that I was thinking of is how a few years ago there were a lot of presentations in Fairfield through different concerned parent groups like Fairfield Cares. They had those presentations on screenagers and the introduction of dialectical behavior therapy in the schools, and just the direct correlation between screen time, and this does tie into school, but screen time and also, mental health, suicides, et cetera. So, I mean, I know there's just being in the health department, I would definitely like to see some of the other metrics outside of just coronavirus, because looking at our data, we're still at 0 deaths in the school age between 0 and 43, correct? I mean, school age population and young to middle-aged adults, that's exactly how old I am. But so anyway, those are a lot of concerns that are coming up that I feel like I'd like to see in the data, and I know a lot of other concerned Fairfield residents and certainly parents would like to see, so that we kind of are understanding health effects in town other than just coronavirus.
And Sally.
Mm-hmm.
Sands, I think we were going to say the same thing for you. I was just going to comment that, Sally, I think those are very important aspects.
Mm-hmm.
I don't even call them sequelae of COVID, but part of the whole COVID picture. I think what would be helpful, and I don't want to speak for Sands, but I think very specific requests, perhaps written out, would be a little bit easier for him, because again, we want to be mindful of Sands and his team and their ability. But I don't want to speak for you, Sands. I'm sorry I interrupted you.
No, I was saying? Just, again, and I've heard these concerns, as well. Again, the metrics we present are the metrics available to us with solid data from the state. And so I would ask, Sally, if you have specific data sources that you're referencing, if you want to send those to me and we can have my staff look at those. But again, like, for example, our school data page, we focus on the indicators listed in Addendum 4, because that's what the state has directed us to use as the indicators, for school learning decisions, and they've directed, school systems to look at that. And so that's why we put that data up. And again, we're always, as you can tell from our data, we're always willing to put stuff up there. We just want to make sure we have good solid data sources that are, that are reliable and relevant, and that, represent what you're trying to get at.
Okay, so thank you. One other question regarding one other point in the presentation about the hospitalized about the universities changing their parameters as far as not going off campus, like some more restrictions that you mentioned. Is that and when they leave campus, is that something that you're going to factor in the way that you're running any of the data? Since if they're not allowed off campus, and what I'm asking Sans, why are you shaking your head, Christine? I'm asking a question about if that will affect the data if they're really in basically remaining on campus. Did I hear that right? That they're not allowed to go on the bus and not leave
no. So they're canceling the buses that go downtown. So, and they're basically asking the students to for the most part, stay on the campus. They're not putting fences up and closing the gates and, ordering them. People who are healthy have the freedom to move as they see fit. And so they can't really order them to not go into town, but they're basically asking that they stay on campus. The numbers will play it out, in terms of is it effective in reducing what they're experiencing right now, and if we went through this just a month ago and a little less than a month ago, and it seemed to curb it pretty quickly, and that was because the students complied with it, and so we hope that that'll turn that. But what's going on outside of that is also just cases in the community in general are increasing. So we're seeing our numbers go up as well. And so our numbers might go up, regardless of what happens at the university in such a way that may end up canceling out any decreases in the university. I mean, we'll have to see where our numbers are when it comes to the point where the students go home altogether. And we'll see how that plays out. We expect it to have some impact for Fairfield, but we'll have to see where we are then, because it's everybody's numbers are going up, and just if you look at the week over week with the community level indicators, they just each week more towns go red, more towns go orange, more towns go the color below that, and so it's just we're.
I definitely see that. It's just that. And I know that came up at the last Board of Ed meeting, but and you referenced the conversation with Jen Jacobson regarding the trend lines increasing, and I think we knew that they would increase, but it's just the fact that you're comparing, looking at the trend lines, and certainly in my conversation with her, it's basically very similar trend lines whether schools were full in person or hybrid. So piggybacking off that, with your conversation with the state this week, did they give any additional guidance like Massachusetts did as far as kind of narrowing some of the parameters in the guidance of including both the number per 100,000 plus like the positivity percentages? Like, was there any other sort of metric given there, or?
So the state addendum 4 has 4 indicators. So the leading and the 3 secondary. So positivity is in there, hospitalizations, COVID-like illness seen in ERs. That's in there along with just the case rate. So it's a measure of both how many cases are we seeing and how broad is it in the community and how severe is the illness. And so the indicators are meant to give a scope of representation of what's going on with COVID in the community from those different perspectives. And that's what the state has, guided us, us as a town to look at when considering the learning models. So, but this week they did not indicate that they any plans to change Addendum 4. They just updated it within the last week and a half, 2 weeks ago. And so they did not indicate that there would be any additional changes to that right now.
So how severe are the hospitalizations and cases from Fairfield? Because that's usually where there's like that asterisk on the you know how it has like Fairfield County, and Connecticut, those data points on the Department of Health site. A lot of times that's like a not reported, maybe. Is that what it is?
So they don't. So they don't report at the local level. So we don't know what's going on at the local level. And again, there's no real assessment of, someone's either in the hospital or not in the hospital. There's no breakout that I am aware of that describes the individual severity, of a particular case. It's you balance cases with hospitalizations and with the deaths that are occurring, and you get a spectrum of what's happening with this. And right now and as I said at the Board of Ed meeting, the hospitalizations and the deaths tend to be lagging indicators, with hospitalizations being 2 weeks after spikes in cases, and with deaths being anywhere from 3 to 4 weeks after. And so if we look at other sources of data like Europe, it's Europe's second wave is far more severe than the first wave, and they're starting to see now hospitals getting to the point where they were last spring with being exceeding capacity. And so that's what's going on in Europe. And Europe, last spring was, about a month ahead of us in what they were experiencing compared to what we experienced. And so we'll just have to kind of see. We don't know exactly how that's playing out this year, but right now their cases are far exceeding their first wave, and the hospitalizations, some hospitals are starting to see capacities being exceeded, and other hospitals have said we are weeks away from being in that same position again as we were last spring.
Okay, I think one last question for now. A lot of the charts say COVID-like symptoms and hospitalizations. Why aren't those just based on COVID-positive cases? Like a lot of them say just COVID-like symptoms. I just don't understand why it's not like a black or white thing in that context, a situation in that context.
Yeah, that's just, that's how the state asks it to be reported. So what are they seeing in the ERs is COVID-like illness, and so it gets categorized that way. And so it's,
So are they not ruling out because you had said the flu was so low right now, are they starting to do the comparison? Because certainly when I get the W-10s from hospitalizations on discharge, and I don't think recently it's had the flu metric. It's just been the COVID, right? Dr. Yoon, do you know that part of it? Have they been just doing a blanket test for both, or no? Because I haven't noticed.
Well, I think in my experience, at least in Stanford, all patients who are being admitted are screened for COVID.
Right.
Primarily just for cohorting purposes.
Right. So they're all getting screened for COVID, but are they going to add flu to that list so they can kind of parse what's what so it doesn't fall into the COVID-like category since there's so many duplicate symptoms?
Right. To be honest with you, I'm not exactly sure.
It just seems like it would be a good question, right? I mean, I can ask, but.
Well, Sans, if you just keep that in mind as we listen out to the state calls, I know that you and I are on at least a couple together.
Yep. I'm making a note. We'll ask it.
Because I'm just shocked as well. Anyway, okay, I'll save that for another time. I know I've asked a lot of questions.
Thank you. Does anyone else have any questions for Sans? Great. Yes, Christine.
And this might be for Jill, just in terms to follow up on Sally for just the concerns around mental health, especially for our children. Do you know if any of the local pediatricians are doing any screening just for, new screening now during the pandemic? And you can say no. I mean, I can make some phone calls if you don't know. Just wondering in terms of, for families that, maybe these are new diagnoses to being referred to other providers.
That's what I'm aware of, Christine.
Okay. Thank you.
This is obviously like colloquially, but just the number of, like I said, the number of messages that I got from people who said that their kids, anxiety, suicide. I mean, these are people I didn't even know. It was just because I asked kind of a blanket statement to people who were having a hard time with hybrid, and they were just so desperate to have somebody listen. And so I think there's just like that concern. The parents were just so concerned.
I'm not even asking about like the school model. I mean, we are living through a pandemic, and there's a lot of stresses that come with just being in a pandemic and everything going on right now. And just wanting to get just a read from a public health perspective in terms of what resources are out there for families. And I know that school is one avenue, but doctors are another. And just wondering if there's any new, if you're hearing anecdotally from pediatrician's office, if they're doing anything different. And that's it. Thank you.
I know the planning committee for the town of Fairfield has been taking that issue up, and they recently met with there's a group out of the Julie DeMarco coordinates that they're working on addressing sort of general resources available for the behavioral health needs.
Thank you. And I was going to follow up with Julie with this question too, but I figured I would ask here first. Thank you.
Great. Thank you. Well, then why don't we move on to the Assistant Director of Public Health Nursing report, Jill?
Thank you. Well, we're going to talk a little bit about flu. We continue to have our smaller weekly clinics of about 3 hours or so by appointment. So far this year, we've administered about 1,400 doses. At this time, we don't have any additional clinics planned because we've run out of high dose, although we are expecting a delivery later in the week, and we'll probably have another clinic next week. Included in that 1,400, we had about close to 200 doses administered at the schools themselves by the individual school nurses, and they would do an after-school clinic for staff, not for children. And that was pretty successful. It's probably the most we've ever given at a school-based clinic. We've been doing that for a few years yet. So let me see. Going on to the demands of contact tracing, and they are many. What we have decided to do is to kind of supplement the work of the contact tracers, at least as far as school-based quarantines are concerned. We feel that the nurses might be, well, first of all, they have more relationships with parents than the contact tracers do. Once a positive case is identified in the school child, that positive case will be followed by the contact tracers, but we're leaving it now to the school nurses and the principals and teachers who have been very helpful in identifying potential contacts in the school setting. And then the nurse will follow up with those families and, give them the start of quarantine dates, the end of quarantine dates, what you should do regarding testing going forward like that. Tina, we took advantage of some of the personal development days last week on Monday and Tuesday, and Tina presented, Santina Geronko, our health educator. She and I presented just how we can integrate the school nurses into the Henry, are you trying to do something with your screen there? No? Okay.
Yes, sorry.
Okay. Just trying to integrate the school nurses and how they can help the contact tracers, just reach out to these families and get the phone calls made and let these people know what's going on. Let me see, what else? So I think going forward, the school nurses will be taking on the responsibility of maintaining contact, generally speaking, with the quarantining students. And the contact tracers will be focusing more on the positive cases themselves. So let's see. We had some more opportunities for training last Tuesday. Northeastern University offered a live online presentation on, I guess, getting to what Sally was talking about, on identifying the mental health and physical concerns of school-aged children in the age of the pandemic. And although no hard numbers were given in terms of, what people are identifying now, I think it helped to at least raise the awareness of the nurses when they're making assessments of children who are coming in for visits. Now, I will say visits have continued to drop down dramatically, and Sally, I think it might be valuable to take a look at what kinds of visits they are seeing, and perhaps even speaking with the counselors in the schools to see if they are seeing any sort of an increase in the use of their services. As well as, Christine, your suggestion about the pediatricians and what kind of screening that they're doing for mental health issues in the children that they see. I guess we have to there's a huge public demand for it, and I'd like to see if we can make some inroads into identifying the problem. The other training that we're doing, I'm sure some of you have heard that the state has introduced a program for the Binax Now testing at schools. I think Middletown is the first school to do it. And we also have pilot programs going on in Danbury and in Bridgeport. And we're working on that as well. The state has offered Binax training for the nurses or any other certified staff who could administer the tests. This week, next week, the week after that, and they have a lot of sessions. It's a short 1-hour training. I'm doing mine on Thursday. Now, it's kind of a fact-finding mission for us at this point. We're not sure that we're going to be actually doing it. I have told Mike Cummings, the superintendent, that, we're looking into it. The nurses have identified, some concerns in terms of, and I'm sure the state will help us with this, how is consent set up, the difficulties of testing an elementary school child with only one nurse versus, the older child in the high school setting when there are 2 nurses available to assist with the testing. So I'm just looking at it right now as kind of a learning opportunity to see what we can do and to see whether or not we will need the program or would it really work in Fairfield. I should tell you that the testing is really only for symptomatic patients, symptomatic students and staff in the school setting. It's not a screening procedure. We're not going to be doing mass screenings or anything like that. At least this is not what this program is intended for. And I believe that is it for me.
Great. Thank you, Jill. I will tell you that we've had that discussion about Binax Now in Stanford as well, in terms of what the role is going to be. And it's interesting because we've also had this discussion with the state that says, well, it sort of it goes against the whole idea of we don't want symptomatic children in the school, obviously. So when we identify them, we want to get them separated from the rest of the population just in case. So the idea of having them or keeping them there, bringing them in to be tested, sort of is a little contrary to what we would originally want to do with symptomatic children. So it's going to be interesting, but it's a valuable tool. So we'll see how that.
I agree. I think it can be valuable in terms of the amount of contact tracing you have to do. If you're able to, the Binax rapid antigen test, they're somewhat more reliable in a symptomatic situation than an asymptomatic. So I think it could be helpful in determining who needs to quarantine in the classroom or not.
Right. And if I remember correctly, for those of you who aren't as familiar with the Binax, I believe it's a nasal swab, correct?
That's right.
So it's not a nasopharyngeal, the one that, as my children say, tickles your brain when you get it done. So great. Thank you. Does anyone else have any questions for Jill?
Well, I'm going to right now. No,
please.
First of all, thank you for. I think that's a good suggestion to talk to the nurse the nurses and other support providers. I will say, just logistically, though, listening, to what you're saying about the major decrease in visits to the nurses' offices. My fifth graders at school from 1 to 3:30, so there's not a lot of opportunity. I will say last week when I wasn't home and my husband wasn't home and my 14-year-old was trying to be helpful and mop the floor, he actually did fall really badly, and we could have really used a nurse right then, but, he was at home. So I think there's that, this is kind of what's happening. I think also for the middle school kids, they're there, my high schooler is fine, my hybrid high schooler is fine, but my 2 middle school kids are there 2 days a week. They already sometimes have to miss part of a class, right, for, let's say, an orchestra lesson or band lesson. So there's that major pressure that on those 2 days that you're there to actually be in the academic environment and not to walk away and not to leave because it's so condensed. So I think what's happening is that there's a major pressure to not utilize the resources because that is your only opportunity to actually be with your teachers and in your academic environment. And so that's why that pressure then is coming back, or the breakdown during the days that they're not in school and don't have the physical resources of nurses and social workers. I know I've certainly reached out to our social worker, and like I said, I know a lot of friends of mine have been discussing reaching out to professionals in the community because they feel like there's not the accessibility that they want in the school environment. And you also know my opinion that I think a lot of those would be alleviated by just actually being at school, the anxieties and the other problems, because they would be, we're treating the symptoms and not the underlying etiology. That's just my opinion. So it's not really a question. Sorry about that, but it's just, I think, an important commentary on I know what I'm seeing and what I'm hearing. So.
Great. Thank you.
Sally, I agree with you. I think that, when the children are in the school, they want to maximize their exposure in the classroom, and those kinds of visits decrease, and, we may not see it in the data. We just may not.
Thank you, Jill. Moving on, Sands, any communications? No. Old business.
I have none.
All right. New business.
There is no new business. I will bring up that next month there will be new business, which would be my 4-year appointment. So that'll be on there. Just wanted to give you a heads up. We'll have to work out how it works out, because usually I bow out of the meeting for a time for you guys to discuss it. So we may have some alternate accommodations next month, but just wanted to let you know that that'll be on the agenda for this month. Thanks.
Great. And actually, since we're talking about reappointments, I also wanted to congratulate Mary Frances on her recent reappointment to the board. Yay.
Thank you.
Congratulations.
Congratulations, condolences, however you want to interpret that. So along those lines, this is also the time of the year, I believe, Sands, we have elections next month, December.
Yep.
So if anyone would like to consider, running for a board position, or either a chair, vice chair, or secretary position, and you have any questions in terms of responsibilities or the tremendous pay that comes with it, feel free to talk to Sands. I'm sure he can give you some additional insight or information.
Sure. Yep. And then we'll also be approving the calendar of meetings next month as well.
Great. I will also be emailing, or I'll ask Sands if you would mind emailing, received just a letter from the town talking a little bit, just reminding us about some of the requirements about meetings, posting agendas, things like that. in addition to a very standard review of the town's standards of conduct. Again, just some housekeeping stuff that I think we go through on an annual basis, but they asked me to share with the rest of the board. So I will forward the email as is. Again, just a reminder of some of the requirements, things that we probably should be doing, or things we should be doing. So I'll forward that as well. And I think that's all I had, other than a reminder of the next meeting is December 14th. And that's really all I had. So
can I just say one thing?
Please.
I just wanted, having worked in the hospitals this weekend, there definitely is an increase. There's no question. I was up to St. Ray's, and there's the whole floor now that's filling up with patients with COVID-19. And we've had a couple of our own my dialysis patients come into the hospital for no other reason that they've had fever and they've been found to be positive, and it's going to be more difficult because we have to isolate them and dialyze them on a separate shift. I mean, I think there is room, what Sanj mentioned about the vaccine. I think that's very encouraging. I think that if we can get the message out that the end is not imminent, but at least it's in sight. And I think if we can, pass along the message to everybody that I think it's a lot easier for people in general, to understand what we need to do now to get us through this time, because the hospitals are starting to feel it. And I'm worried it's going to get worse. I hope it doesn't, and I hope that the vaccines are coming as quickly as they can, as long as they're tested and are safe. But I'm pretty optimistic about that. But I think it's because we know that the end is in sight. I think that as a community and as a state, I think that if we know that there's some optimism at the end of the road, maybe make it easier for people to do what they need to do, because it's concerning to me right now with the number of patients in the hospitals going on.
Excellent point. Thank you. All right. Does anyone else have any comments, questions? Otherwise, if I can get a motion to adjourn. Great. Fantastic. Meeting adjourned at 8:43. Thank you, everyone. Be safe.
All right. Thanks, everyone.
Have a good night.
Thanks, Sam and Jill. Thank you.
Good night, everybody.
Thank you very much.